Hi, my name's Stuart Kerr. I run the ultrasound scan and ultrasound guided injection service with my colleague Emmett Kennedy here at LifeFit Wellness. I'm going to talk to you a bit about shoulder problems. We see a lot of shoulders in the clinic, and there are a lot of different types of shoulder conditions that can manifest. However, I'm going to touch on just a few of the most common, starting with the rotator cuff. Now, the rotator cuff are actually a group of 4 muscles and their associated tendons that give this ball and socket joint a hug. You've got one at the front, one more towards the top, and then 2 at the back of the shoulder. Commonly, the tendon or tendons of the rotator cuff are the common culprits, and that can range from tendinitis to some tears of the tendons, and sometimes you have associated conditions of something called the bursa, commonly the subacromial bursa. These tendons and soft tissue structures can become inflamed and irritated and therefore cause pain. First of all, we can scan that area diagnostically to get a real handle on what the specific nature of the problem is, and then we have a range of treatment options. Sometimes that's guiding your rehab a bit more specifically, and other times we can consider various ultrasound guided injection treatments. Another really common problem is a frozen shoulder, sometimes called adhesive capsulitis. This affects the capsule that lines the ball and socket joint, and that sits even deeper to the joint than the rotator cuff. What happens with a frozen shoulder is that line becomes inflamed and constricted, such that it tightens up and doesn't allow you to move that shoulder as freely, and indeed it's painful when you do so. If this is the case, we can offer an effective treatment known as an ultrasound guided hydrodistension. And this is an injection treatment that not only provides some anti-inflammatory relief through a steroid, but it also adds a higher volume of saline, sterile salt water to stretch that constricted capsule, thereby bringing about improved range of movement and reduction in pain. We also see calcific tendinitis. Now, that's something that commonly affects the rotator cuff, where you get a deposit of calcium situated within the tendon. This can often be very, very painful, particularly when the body's trying to reabsorb that. Again, diagnostically we can scan that, and we have a couple of different treatment options, from a standard steroid injection to something called barbotage, where we try to break up and extract some of that tendon. And finally, we're going to turn our attention to the smaller joint at the top of the shoulder known as the AC joint, or acromioclavicular joint. And that's the joint that connects the tip of the shoulder blade known as the acromion to the collarbone known as a clavicle. We can get conditions of overuse there, often through weight training and such like, and it's a joint that can be affected by osteoarthritis. Again, if we're struggling to get that settled through other means, then a carefully guided injection can help to settle that. So if you have a shoulder problem of any nature, you want to get to the bottom of it, and you want to talk about some injection treatment strategies, please get in touch.